Hey everyone, this is Emily Eveland from Healthy Places More Than Borderline blog. So today I want to talk to you about coping with high emotional intensity, which is at the very forefront of borderline personality disorder. It's one of the defining characteristics. This results from, as I've talked about before, sensitivity, and the problem comes in when we don't have effective coping skills to deal with it. So when your intensity is super high, and there's no sort of rational thinking or what DBT would call reasonable mind or rational mind, and you're totally an emotion mind, you have to use a very specific skill set. And in DBT, this would be called TIP, T-I-P-P. T is for temperature, I is for intense exercise, paced breathing, and then paired muscle relaxation. The temperature aspect is really interesting. This is biologically proven to work. One thing that my DBT therapist, that's dialectical behavioral therapy, recommended is to basically plunge your face into a bowl of ice water. And that triggers the drowning response. So you essentially just wake up, you come out of it. If you don't want to do it that intensely, you can hold an ice cube. You can put an ice cube on the back of your neck. Rub it along any part of your body that is feeling numb or tuned out. For intense exercise, some things that I like to do are, find a punching bag, wear gloves, sprint down the block, sprint back, get on your bike as fast as you can, as hard as you can. The goal is to do super intense exercise, not just walking. You want your heart rate to get up there. Paced breathing is just, counting your breath. Paired muscle relaxation is tensing and then untensing. Other things that I like to do are, I have a weighted blanket, which is also for PTSD. It's just a grounding tool. I use adult coloring books just to get out of my own way, get out of my own head. Another thing that I learned in yoga is to use tennis balls under your feet, because your feet are really what are going to, bring you back to earth. You want to feel your connection to the earth. So one thing you can do is take a tennis ball and kind of roll it back and forth under your foot, just applying a lot of pressure. Any sort of meditation is great. Guided meditations are the best starting point, I think. The other DBT skill that I will talk about eventually is for less intense emotions is accept, which is activities, contributing, comparisons, opposite emotions, pushing thoughts away, coming up with other thoughts, and providing new sensations. So under this category, it could be things like watching silly YouTube videos, comparing yourself to someone who has it worse, using your five senses, so locating a smell, touching something and locating that, looking at something brightly colored, tasting something, putting something in your mouth and just really paying attention to the flavors and just trying to come back out of your, highly intense place. So I hope this has been helpful, and let me know if you have any other ideas or techniques that you've used that have proved to be effective. All right, thanks.